In this video, we'll be covering 4 mistakes to try not to make in writing your medical personal statement. These are things that we often see in personal statements that when you read 30 or 40 on the trot, they become very obvious when people do it. It's worth seeing this video before you write your personal statement, and then after you've written the personal statement, come back, have another watch of this video, and then make sure that you haven't fallen into these traps. I cannot emphasize enough how important it is to not be generic. Remember that as admissions tutors, we will be reading through multiple personal statements, one after the other. When you write your personal statement, think in your head, if they were to mix up the applications and had to pick yours out from a pile, is there something unique enough about your application, your personal statement, that you could identify it as yours? Now, there's a reason we call it a personal statement, and that's because we want you to put in your own personal experiences. We want it to be unique to you. So do not fall into the trap of having very generic examples without putting a personal, specific example that's specific to you and your experiences. I'll give you an example. It's one thing to write that you were the captain of the first team for cricket, and it's another to say that you were extremely proud to be the captain of the first team for cricket and you've won the last 10 matches in a row. Even though you don't have the strongest team, the whole team comes together and works together to get the very best out of each other. And that's the way in which you've succeeded in making sure that you've won each of your matches. One of them, the first one, doesn't sound very exciting. The second one shows that it's personal to you, that you've won the last 10 matches, but also it shows a point of passion, that you are proud of this. This is something that you've actually worked towards as a team. And by doing so, not only does it flesh out the example, but it also makes it specific to you. So if your application got mixed up with multiple other ones, you could still pick your one out as the person who was the captain of the cricket team who was really passionate and won the last 10 matches, even though they didn't have the most talented team. Alongside being generic, the other thing that is a real bugbear for people reading multiple personal statements is things being cliched. Now, it's easier said than done, because cliches are used for a reason. They convey a message very clearly. But try and avoid multiple cliches. But it is acceptable to use it as part of a wider point, but which you can personalize. For example, take the statement, "My desire to study medicine stems from a passion for helping people. I've relished the opportunity to work as a healthcare assistant at St. Mungo's Hospice, looking after people at the end of their lives. As a doctor, I hope to combine this passion with a deeper understanding of the pathophysiology of their symptoms, thereby providing the medical as well as psychological support patients require." Just think about that statement. Not only have you said that you've got passion for helping people, you've given an example of that by volunteering in a hospice. But more than just volunteering in that hospice, you've taken something away from that experience. You've said that you've found it humbling looking after people at the end of their lives. And you've moved that one step further on from that by then saying that you're going to move on to using this passion that you have as a doctor by combining it with the stuff that you're going to learn as a medical student, to learn the pathophysiology, to treat the patients, but also be cognizant of their psychological needs. It not only highlights why you want to do medicine, but it also gives proof of what you're saying. It's not you just saying something generic. You've got a concrete example of where you have developed these skills. So even though we've used that cliche at the start of "my desire to study medicine stems from a passion for helping people," you've fleshed it out with an example that's personal and specific to you. So even though there is a small cliche there, it's diluted by the fact that you've got a really strong, clear example which is relevant to your personal statement. A really easy mistake that people fall into is when giving an example, they are not specific. I can tell you right now, as an admissions tutor, we are inherently skeptical of any claims that are made on a personal statement. We know that a personal statement is there to try and build yourself up, to try and sell yourself. As such, we know that there's a little bit of artistic license with what people write. As such, we are going to believe someone far more if you have specific examples and specific situations explained in your personal statement compared to just very generic statements. So give names of places that you've worked, give dates and timescales. It's one thing to say, I volunteered at a hospice, and it's another thing to say, I volunteered at St Mungo's Hospice for 6 years where I worked on X, Y and Z ward. Immediately, one of those you'd say, oh, well, maybe they just turned up for one day and then left. Whereas the other one, you know that they've really showed commitment, that they've been there for 6 years, and you know exactly where they've gone. So there's no chance that they could have lied or embellished that because you've given very specific details. Also, when you're giving examples, for example, what you got out of your work experience, some people just list a whole bunch of things that they've done, but that's not what we care about. Anyone can go and do some work experience and see a whole load of stuff. What we want to see in the personal statement, and also in the answers to your interview questions, is that you've got something out of it. So, we want you to say that you went and saw a cancer clinic, and that you sat in with the doctor and you saw a whole load of patients being followed up for cancer treatment, and also some patients who are newly getting a diagnosis. But that doesn't give us any information about you. The next bit is the bit that'll then give us information about you specifically. If you then go on to say, for example, you were humbled by the way in which the doctors and the nurses approached the patients, the compassion and the empathy that they showed, that you really enjoyed the teamwork and the camaraderie between the doctors, the nurses and the specialists and the surgeons to try and get the best treatment for the patient, that you were amazed by the way in which things were moved through really quickly to get a diagnosis of cancer and to start treatment, all within 2 to 6 weeks. All of these things show that you've gone beyond just sitting there and watching something, and you've actually internalized that experience, taken something out of it, and actually helped with your understanding of knowing what it is to be a doctor and what it is to be a medical student. Because that's exactly what we're looking for as admissions tutors. It's not that you've seen something, but it's that you've actually taken something out of the experience that you've had. Now, you will be surprised how often we are going to have people not actually giving a specific reason for wanting to be a doctor. The whole point of your personal statement is to try and convince us as admissions tutors that you want to be a doctor. You have to try and give specific points of how you have worked your way through the decision to apply to medical school and to want to be a doctor. Now, this can be really difficult because for some people they may have had specific events in their life, like a loved one getting unwell and having a real intimate experience with the healthcare profession as their catalyst for wanting to be a doctor. For other people, like myself, I never really had that. I just knew I wanted to be a doctor. It was something that I was always interested in and I'd read about, and I just tried to get as much experience as possible, and it really meshed with my personality. But it's really important because if you just say that you want to help people, one of the things that we say as admissions tutors in interviews, well, if you want to help people, why did you choose to be a doctor? Why didn't you choose to be a fireman or a policeman or a nurse or a healthcare assistant? Why a doctor? Why should we give you the doctor job as opposed to you applying for any of the other things? So really think about what it is that you're interested in and what makes being a doctor unique. We'll go through some examples of where people have given really good answers to this and really bad answers to this in a later video. But it's also worth you just thinking personally about what it is that's drawn you to this profession. It's also really important if you're a graduate who's aiming for graduate entry into medicine. Because as a graduate, you've already shown that you're academically able, that you're able to cope in a university environment. But what you need to show is that medicine is different to scientific degrees. In addition to the science, in medicine, there's the whole dimension of the patient that needs to be taken into account. And the whole emphasis of medicine is on translating the science into benefit for patients. As admissions tutors, we're quite wary of people who are just interested in science and want to do medicine because they're really interested in science. What we want to see are people who are interested in people, in patients, that they are able to take their interest in science but translate it into the important part of being a doctor, which is looking after patients. And it's quite obvious from some personal statements that some people are just solely interested in the intellectual challenge of medicine and completely miss more than half of the job, which is the joy of actually working with patients. And when we see that, it's very rare that those people actually get into medical school, because for them, it's probably way more suited for them to do a biomedical sciences degree or another pure sciences degree, because that's much more what they're interested in. But if you want to do medicine, you have to be patient focused. Again, as a graduate entry person, it's really important to try and showcase your skills. Even if you've not done a scientific degree, there are going to be multiple skills that you would have developed, like critical appraisal of literature, working with different people from different backgrounds, developing your learning methods for being at university, which are very different to being at school. Being able to independently learn and to be able to write essays and to critically think about the stuff that you're learning and reading around the things that you're learning. But the same is true of undergraduates, people who haven't been to university before. You can also showcase those exact same skills, and that's where in your personal statement, by having the examples like doing additional degrees or papers or Olympiads and exams, in addition to writing essays and being part of the medical dental societies and other societies, what you're trying to showcase is your ability to read around subjects, to critically appraise data, and to be able to think critically about science. But ultimately, what you want to try and show is why you want to be a doctor. Make sure that it's personal to you, that you've got a specific example or examples in place. And if you're in any doubt, make sure that you mention your work experience. Because even if you haven't got a personal experience of seeing a patient in hospital, by the end of your work experience, you should have at least seen 1 or 2 patients who have gone through their patient journey. And speak about the impact that that's had on you, on your understanding of what it entails to be a doctor. We'll be going through multiple more videos where we'll talk a little bit more about the reasons why people want to be doctors and some of the points of being a doctor and some of the highs and the lows of that. So it might help catalyze you to develop an idea of how to respond to the question of why do you want to be a doctor. So it's really important to try and think about these 4 things when writing your personal statement. You will probably find examples of each of these things in your first draft of your personal statement. If you do find examples of it, then try and change it. But if you can't get rid of a cliche or something that sounds a bit generic, try and put an example and make it a personalized example to you. Even if it's a cliche, it doesn't matter because it's personal to you and it's very specific in the example that you give. However cliched it sounds, actually you've put it into the context of yourself, and that's what matters with a personal statement. And I cannot emphasize enough how important it is for you to have that test of, if you were to put your personal statement into a pile of other personal statements without your name on it, is there something memorable in your personal statement about you that's there that can make someone pick it out and say, oh, that's your personal statement. If you haven't got that, go back, have another think, have another draft, and talk to other people. Talk to teachers, talk to doctors, talk to medical students, and see what you can do to try and make your personal statement more memorable and more attention-grabbing.